Hi everyone. So I chose to do my case study on a client who I found to be the most interesting that I've worked with throughout all my placements. He wasn't really a complex case in terms of his physical state, but it was more the cognitive impairments that he experiences that made it quite a challenge to work with, but I'll get into that a bit later. I also wasn't present for his initial assessment, but I worked with him quite a bit when he came in to do his exercise program. So I think there might be a few people who might find this client familiar because he did work with a fair amount of students. So the client was a 62-year-old male. The reason for his referral was a left middle cerebral artery stroke, which occurred in June this year. Due to his stroke, he experiences both receptive and expressive dysphagia. He also has high cholesterol and hypertension, which are both controlled with medication. The PARQ was used as part of the subjective assessment, and his wife also attended the assessment with him, and she answered the majority of questions due to his dysphagia. So, for any of you that aren't that familiar with what dysphagia is, it is the partial loss of an individual's ability to produce or understand spoken or written language. So the term aphasia is often used to describe it as well, but that means that there is a complete loss of one's ability to understand and produce language, whereas dysphagia is only the partial loss of those abilities. It occurs when there's damage to the left hemisphere of the brain, in particularly Broca's area or Wernicke's area. So receptive dysphagia is when you have trouble comprehending language. So the client would often speak fluently but would jumble up his words and talk gibberish, and he was often not aware that he was making no sense at all, because to him he was making perfect sense. Expressive dysphagia is when you have trouble producing speech. So the client would often have trouble finding the right word, or instead say something completely different, or would miss certain words when talking. As his receptive dysphagia was more prominent than his expressive dysphagia as well. So as he experienced both, it was quite challenging first off when taking him through his exercise program and trying to communicate to him as well. His past medical history. So he had triple coronary artery bypass surgery in 2009. He had an acute myocardial infarct in 2008. He's also had supraventricular tachycardia episodes in the past, but has had none since his stroke. He was previously a smoker and has a family history of heart disease. His medications are listed there, so he's taking one for his cholesterol, one for his hypertension, and a couple stroke-related ones as well. His social history. So he lives with his wife and daughter. His wife works full-time. He's currently not working, but in the past he was a journalist, so he was once really good with expressing and comprehending his words. Prior to the stroke, he was back studying, but obviously had to stop that. He was quite active before his stroke. He went on daily walks for about 30 to 40 minutes. Currently, he's undergoing daily hand therapy with the OT to help with his fine motor control so that he can complete the ADLs that he's having a little trouble with, such as cutting his nails and holding the toothbrush when brushing his teeth. Other than that, he's not really doing any other exercise. He can't drive, so he walks to the shops, but he often gets extremely tired from doing that. So he doesn't go very often unless he can afford a taxi. So there are a lot of other health professionals involved in his care. So the OT has a lot to do with him. As I said before, they prescribe him a hand therapy program. They also organise his travel to and from the gym due to his cognitive impairments and the fact that his wife also works full time. So they created what's called a communication card, and that just says on one side that he wishes to book a taxi, and on the other side of the card it has his address. So he can just show that card to reception and then they can call one for him. And then he can hand the card to the taxi driver as well, so the taxi driver knows his address. I think now, though, he can actually just ask reception himself without using the card, but still may have to use it when telling the taxi his address. He's working with a speech pathologist as well on both his receptive and expressive language, so that just involves focusing on his basic commands, short phrase picture matching, and semantic networking using distractions. He's given some activities that he can complete at home, such as word finds as well, to help with those things. He's also got some involvement with his neurologist and a social worker as well. So in terms of the objective assessment, it was pretty basic due to his cognitive impairments, and from all reports he was struggling with performing the tests correctly. So his blood pressure was taken, and a 6-minute walk test and 30-second sit to stand were performed. So the 6-minute walk test was done to assess his aerobic capacity, and it also provided an opportunity for some gait analysis. He recorded a distance of 310 metres, which was below average. During the gait analysis, some right knee valgus was observed, which indicated some abductor weakness. Also, during the test, he experienced some high blood pressure readings, so that would be monitored pre and post exercise when he came in to perform his exercise program, although I think now we just do it post his exercise program, not before. A 30-second sit to stand was also performed to measure his lower limb strength and endurance. He performed 13 reps, which is below average for his age, which indicated a decreased lower limb strength and endurance. So the results showed a decreased functionality in terms of his lower limb strength and aerobic capacity, and his cognitive impairments will mean that he will require continued assistance while in the gym. So it would be important to use clear and simple communication and make use of a lot of demonstrations. Work would also be done with the speech pathologist to find ways of increasing his independence and cognitive ability in the gym, and hopefully that would translate in just his normal life as well. So the problem list is his lack of independence in the gym, as well as his lack of cardiovascular fitness and lower limb strength. So his functionality would be affected. The rehab centre that I was at didn't place a huge emphasis on setting SMART goals. The patient did report that he wanted to get back to walking daily so he would be able to walk to the shops and that kind of thing without getting extremely tired. In terms of therapist goals, they focused on increasing his cardiovascular fitness and lower limb strength so that he could be more functionally able, as well as to increase his independence in the gym, as it was often hard for the supervising exercise physiologist of the group sessions to keep monitoring him while trying to keep an eye on all their other clients, because he required a great deal of assistance, and if you just left him on a piece of equipment, he would just keep on doing as many reps until somebody told him to stop. So A gym-based program that consisted of both cardiovascular and resistance-based exercises was prescribed. It would be performed 2 times a week. So the cardiovascular exercises included the rowing machine, bike, and walking laps. Being 4 weeks into his program now, he's progressed really well. He now does about 10 minutes on the bike and is now on the treadmill for 5 minutes. The strength-based exercises focused on the large muscle groups of the lower limbs. Again, he's progressed really well with those. 2, he is now doing 60 kilos on the leg press, and instead of the 30 that he started off with, and he's now doing around 3 sets per exercise and tolerating it really well. During the program start, he actually did really, really well. He didn't have any issues with technique or remembering which exercise he had to do and how to do it, which is good. My supervisor used a lot of demonstrations and just short and simple instructions as well. So during the exercise program, I get him to do a number of cognitive tasks that were set out by his speech pathologist. A lot of studies actually show that doing cognitive tasks when exercising has a positive effect on one's memory, attention, and verbal comprehension and fluency. So with the aerobic exercises, a post-it note with the time and the word stop was placed on the screen. So he would have to match the image with the time and the word stop with what he had to do. So that was really effective. And now I can just tell him to stop at a certain time and he does that. I also get him to count the repetitions by looking at a laminated card that has the numbers 1 to 10 on it. When he does this, he will often start really well, but then jumble up his numbers. So he would say something like 1, 2, 3, 4, 4, 7, 1, 2, 3, 4, 4. And then when he's finished the reps, he would say something like, oh, that was a good one. I got them all right. And you just have to tell him that he started well, but he did get them a bit jumbled at the end. He is gradually improving though. He did correctly count up to 10 with the calf raises, which was really good. He also gets confused with the leg press as he counts both the concentric and eccentric actions as a rep. But I pointed to the numbers on the laminated card when I wanted him to say it, and that actually helped stop him counting both actions, which was good. He'd also be telling a story or talk about his weekend, and suddenly he would begin talking gibberish, and you'd have to say stop. Now can you start from the beginning? Because he was unaware that he was doing that. So in terms of his plan, there will be a continued collaboration with the speech pathologist to incorporate speech therapy into his exercise program based on his level of speech improvements. And he has seen quite a bit of improvement since he first started from all reports. He'll continue with his gym program, attending 2 times a week, and the exercises will be progressed as tolerated. We plan to gradually transition from pointing to the number of reps to no pointing to increase his independence with some exercises, including the leg press. He'll continue to attend his speech pathologist and occupational therapist, and we will review his progress in 2 weeks' time. So there are my references, and thanks for watching.